morning. I'm Todd Severnak. I'm one of the hospital doctors here at North Shore Health. What's your name?
Hi, Dr. Severnak. My name is Flavia.
Flavia, nice to meet you. What brings you to the hospital this morning?
I've been with a cough for several weeks. I think it has been about 2 weeks.
Okay. And is it any other symptoms, any shortness of breath, any fevers or chills? Are you bringing anything up?
Yes, I've had some fever for a little while and shortness of breath at times, yes.
Okay. All right. And so what made you decide I'm coming to the hospital this morning?
I haven't been able to sleep. My appetite hasn't been very good either. So
Okay.
I've been losing some weight too.
Oh, okay. Now, are you having any other symptoms?
Not that I can recall at the moment.
Okay. Is anybody else sick at home?
I haven't noticed any other of my family members at home with the same symptoms, at least.
Okay. All right. And do you feel like you're getting better, getting worse, kind of staying the same?
Staying the same?
Okay.
Yeah.
All right. So I'm just going to go through any headaches or nausea or vomiting or chest pain, diarrhea, burning with urination, or other symptoms that we forgot to talk about?
Headache, mainly, and very tired.
Okay. Now, are you otherwise a fairly healthy person, or do you have other chronic medical problems such as high blood pressure, diabetes, lung problems, asthma?
No, none of those.
All those, you're pretty healthy?
Yes.
Okay. Do you take any medications on a daily basis?
No, I don't.
No. Are you allergic to any medications?
Not really, no. No.
No. Okay. And what do you do for a living?
I work in dietary.
Okay. All right. Are you married, widowed, divorced? Do you have children?
I'm married. I don't have any children.
No children? Okay. And do you smoke?
No, I don't.
No. Alcohol?
Once in a while.
Once in a while? Okay. And how about your mother and father? Are they still alive?
Yes, they are.
Do they have any medical problems?
No, they don't.
No, they're both healthy?
Healthy, yeah.
Okay. I'm going to take a quick look at you with your nurse's help, okay? We'll just kind of start up on your head and we'll work our way down. And then after that, we'll kind of talk about what I think is going on.
All right. Sounds good. Thank you very much.
All right. Why don't we go ahead and get started? We'll go ahead and start with the eye exam and we'll kind of work our way down. I'm going to zoom in pretty close here. You go ahead and look right at me, Flavia. There we go. All right. Let's go ahead and start her right eye, then left eye. Good. Other eye. Good. And open your mouth real wide for me. Perfect. Good. All right. Let's go ahead and palpate down her neck. Let's make sure that she doesn't have any hard nodules under there that feel right in the front.
No, nothing.
Okay. Nothing. Okay. Let's go ahead and grab the stethoscope. I want to listen to her heart and lungs real good here. We'll start off with heart sounds in the front. Let me get it turned on. I'll let you know. Okay, it's on.
It's just heart.
Okay, good. Why don't we have her lean forward here? Let's do lung sounds in the back.
This is top right.
Nice big breaths for me. Good.
You can lean back.
Have her go ahead and lean back. Let's listen to her abdominal sounds. Hang on, let me get it. There we go.
I'll start top right. Bottom right.
Good.
Top left.
All right.
And bottom left.
Good. Pretty gurgly in there today. Must be hungry. All right, let's go ahead and palpate her abdomen. Make sure there's no lumps, bumps, swelling, or tenderness.
Any pain with touching?
No.
Soft and non-distended.
Excellent. Take a quick look at her legs here.
No edema bilaterally. And pulses are palpable.
Good. All right. Well, Flavia, looking at your history, looking at your labs, and looking at your chest X-ray, it looks like you have a little bit of pneumonia in there. You've got what we call an infiltrate on your X-ray. You've got your white blood cell count is up, and I think it's a good thing you came to the hospital. I think if you didn't, you would start to get sicker. I think you need antibiotics. So we're going to keep you here for probably the next 24, 48 hours. I'm going to put you on an antibiotic called Rocepin. We'll put you on some IV fluids. We'll give you a little bit of cough medications. I anticipate you start to get better in about 24 hours. Your nurses will continue to monitor you, and we'll check labs again in the morning. We've got blood cultures in the ER, so we'll make sure those stay negative. Do you have any questions?
Not at the moment, but thank you very much.
You're welcome. I'm just going to talk with your nurse here for a second to make sure that we're all on the same page here.
Okay.
Hi, Dr.
All right. Do you have any questions?
No, not at this
Any concerns
time.
that we didn't talk about?
No, she's doing fine. The fever's been maintained with the Tylenol, so she's down back to 99.1. So she's doing well.
All right. Well, we'll put her on a little Rocepin, a little normal saline, some cough medications. Something doesn't seem right, please contact me as always.
Okay.
You guys have a great day.
Thank you.
Bye, Dr. Severnak.
Bye-bye. Yeah, our telemedicine equipment is state-of-the-art. It has Zeiss lenses on it, meaning I can zoom in extremely close to the point I can see an individual eyelash. We have very high-fidelity stethoscopes on there where I can hear heart sounds as well or better than with the stethoscope I use in person. I can turn the volume up very loud to the point that it can actually reverberate and people in the room there can hear it. Our exam is quite good. Nurses are quite experienced at doing physical exams. Other peripherals are potentially be added, the ability to look in people's ears if we need to. We can focus very closely on skin rashes. The focus is quite detailed. The exam is just like I'm there in person. The only thing is the nurses is used as my arms for touching, but the exam is real time. It is fairly close to actually doing the exam myself. Other information, I have access to all the lab data real time. I can look at x-ray data, CAT scan data, and anything that's available. I have access to the medical records, just like I was in person. The first thing I do after seeing a patient is I put in orders, just like I would if I was in person. I'm actually accessed to the North Shore Health computer system. All the information stays there. It does not transmit it any place else. I'm actually logged into their system like I am sitting at a computer there. Enter the orders into the computer. Then we use a speech recognition program, and I write out my plan and what we call the history and physical for the nurses to follow and other physicians to follow, and it's the same process that would be used if I was sitting in person up in Grand Marais. The notes that come out will be exactly the same as an in-person exam, except on the bottom of the note this will say this was done through virtual equipment. If a patient needs to be transferred to another facility, I would handle it just like I would in person. I would, most of the time I will be looking at the patient with the telemedicine cart, assessing with nursing, saying, yep, this patient is no longer appropriate to stay in North Shore. will be contacting Duluth or whatever facility that they need to go to. I will speak with the physicians there and set up the transfer process and the paperwork to transfer the patient just as I would if I was in person. For patients who don't speak English, North Shore Health has multiple options that can be used to translate depending on what is available and the language we're looking for. This can vary from computer screens to telephone translation services. We can use any of the services available to the in-person physicians through the telemedicine. Overall, I think telemedicine is going to be the wave of the future for rural healthcare. I think this is only going to expand to the point that there will be subspecialists available to rural facilities for consultations. This is going to be a worldwide phenomenon. I don't think this is going to be local. This is, I think, the start of it, and over the next 5 or 10 years, this is going to expand exponentially and will significantly change the delivery of healthcare.